begin in the nation's capital, where President-elect Bola Tinubu has continued to receive visitors at his Asokoro residence barely a day after he returned from holiday abroad. These are images of some of the people he met earlier today. That's the national chairman of the All Progressives Congress, Abdullahi Adamu, joined the list of visitors at his Asokoro residence, which includes Senior Senator Godswill Akpabio, Governor of Ekiti State, Biodun Oyebanje, among others. And obviously, in the days ahead the inauguration, it is expected that the president-elect will be busy receiving more visitors and well-wishers. The president-elect arrived in Nigeria yesterday from France, where he had gone to rest after the 2023 election. He was given an overwhelming welcome at the presidential wing of the Nnamdi Azikiwe Airport, Abuja. Asiwaju Tinubu says he's ready for the task ahead in fulfilling his renewed hope promise to Nigerians. And many youths in Adamawa State Monday trooped to the government house Yola to celebrate Eid al-Fitr and Governor Madu Finteri's victory at the just concluded polls. Receiving the teeming youths, Governor Finteri says he plans to engage 20,000 youths to reduce poverty in the state. He announced that youths would form 80% of his cabinet, especially for their support at the just concluded governorship poll. He advised them to pray for the peace of Adamawa and the nation, stressing that his administration will be the government of the people.
The season of fasting has just ended, and the celebration is coming with a victory that is beyond expectation. So everyone in Adamawa, irrespective of their political party, are just, moving here and there, excited by the fact that this is Salah celebration. And we are glad it's happening in Adamawa State.
And away from that, the Economic and Financial Crimes Commission says it is ready to combat money laundering being perpetrated by some real estate firms across the country. A legal advisor in the commission, Chris Michela, said this at a workshop organized to train journalists on effective reportage on the activities of the anti-graft body in Benin, Edo State. He maintained that there is need to sensitize members of the public on the expanded scope of the Money Laundering Prohibition Act 2011 while dealing with real estate companies which serve as a conduit for money laundering by individuals, organizations, and government functionaries.
Identify a customer. Only in Nigeria someone would have $1 billion cash. It's difficult to find it in the developed world. So the essence is monies that go through financial institutions can be trailed. Unfortunately, in Nigeria, even in the government cycle, government funds are being withdrawn cash. Not even private funds. Government monies are being withdrawn cash. These only open rooms for stealing, open rooms for corruption. So the provision that criminalizes payment.
And back here in Lagos State, government at all levels have been advised to introduce technology into healthcare delivery across the country. Medical personnel gave the advice at a meeting to discuss issues affecting the sector. Theophilus Elama has details.
Digitization has become a major force since the advent of technology. The internet has democratized access to information, and the health tech industry is seen as a fast-growing market worldwide. Practitioners here are of the opinion that the health sector in Nigeria is seeing very gradual disruption in digital innovations.
Need participation of the private sector and the government as well. Collaboration to scale would be something that should be a hot topic already, right? The government needs to understand the digital landscape, understand that internet penetration is here.
Technology has always been one of the key factors that's going to play in the development of the Nigerian healthcare sector specifically, especially the African healthcare sector, simply because one of the first things it does is to democratize healthcare. We have a lot of people who live in very unreached areas, and with technology, they can accept premium quality healthcare.
In 2018, the World Health Organization estimated that there are 3.81 doctors per 10,000 population in Nigeria. This is more worrisome when extended to specialist doctors. Health practitioners here say if technology is appropriately applied, it will address brain drain in Nigeria's health system.
We have an average of 1 to 30,000, our doctor-to-patient ratio. In the north, we have 1 to 45,000. Now, this tells you for an emergency or a situation where a patient needs to speak to a doctor, you have just one doctor to cater to 45,000 people. There's no way a human being can split himself in multiple locations. But with digitization of healthcare, with telemedicine, we have one person speaking at his convenience to people that don't need to walk out of their homes to go to the hospital.
At the back of brain drain, there is a brain gain. But what I want to ask you, what this tech is saying is, we can plug in immediately and get the brain gain without waiting for that long.
In the age of technological advancement, medical practitioners believe investment in infrastructure will help boost the health sector in the country. Theophilus Ilama, TVC News, Lagos.
And still on health matters, more than 21,000 patients have benefited from the free medical and surgical service organized by the Osun State government. The exercise, which took place in 9 federal constituencies, which make up the state, recorded at least over 2,000 beneficiaries in each of the constituencies. Addressing journalists in Osogbo, the Chief Medical Director of the Uni-Osun Teaching Hospital, Professor Peter Olaito, said more than 9,000 persons were treated for eye problem, out of which over 2,000 were given glasses. According to him, other health challenges were also attended to by the medical personnel throughout the 10-week exercise. Professor Peter Olaito said the motive behind the exercise is to ensure residents who have no financial capacity enjoy a healthy living at their various communities.
Of these patients, we had 9,133 of them with eye problems, and out of these people that had eye problem, we had 2,415 of them benefiting from glasses, and we had total of 705 patients benefiting from eye surgery, either pterygium or cataract surgery. And for the general surgery cases, we have 1,453 patients, and for the medical care, we have 10,543, making this total of 21,834.